Assalamualaikum viewers and welcome back to my channel Biodinverse Hub. Today in the playlist of oral and maxillofacial surgery, we will be discussing about the pterygomandibular space infection. Pterygomandibular space is one of the masticator spaces. Other spaces involve the deep temporal and superficial temporal and the submesenteric space. These all are known as the masticator spaces because they contain the muscles of mastication involving the lateral pterygoid, medial pterygoid, temporalis, and masseter muscle. Another important point about the pterygomandibular space is that it is the area where you inject your local anesthesia during your inferior alveolar nerve block. So, in order to understand the pterygomandibular space infection more deeply, we will first need to study the boundaries of pterygomandibular space. As you can see in the diagram as well, anteriorly we have the pterygomandibular raphe, posteriorly we have the parotid gland, medially we have the medial pterygoid muscle, laterally, we have the medial aspect of the ramus. Superiorly, we have the lateral pterygoid muscle. And inferiorly, we have the pterygomesenteric sling. Now, moving on towards the content. So, what are the important structures that are present in the pterygomandibular space? It includes inferior alveolar nerve and vessels and the lingual nerve. As far as the source of infection is concerned, any odontogenic infection arising in the third molar, that is mesioangular or horizontal in the angulation. In the advanced cases, the infection will spread and involve the pterygomandibular space. Second important source is the contamination during the IA and nerve block. That is, if you are using any contaminated syringes or let it be any other source of contamination during the process of injecting your local anesthesia, you can directly infect the pterygomandibular space. The third important source is that any infection from the sublingual space in advanced cases can further spread and involve the pterygomandibular space as well. So these were the three important sources of infection. Now we will be discussing the clinical features. So in the any infection of the any of the masticator spaces, the first and the foremost important clinical feature will be the trismus. Because remember that these masticator spaces involve the muscles of mastication, so any infection out there would directly involve your muscles of mastication and patient will experience trismus. There will be no external swelling, anterior bulging of the soft palate and anterior tonsillar pillar, deviation of the uvula to the unaffected side, and the patient will also experience difficulty in swallowing. As far the spread is concerned, so in the advanced cases, the infection from the pterygomandibular space can spread on and involve the infratemporal space, lateral pharyngeal or retropharyngeal spaces. Now, as the management is concerned, we will go for the incision and drainage, extraction of the culprit tooth, the antibiotic therapy, and the supportive hydration therapy as well. Or we can do the other supportive measures as well. So the management is as a whole discussed in a separate video for the odontogenic infection. You can consult on to that video for the management. So it was all about the pterygomandibular space infection. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also click on the bell icon so you will get notified about our future videos and updates. Thank you.